During the pregnancy, someone notices they have a tendency to spill some sugar in the urine. You go and you say, you will have gestational diabetes. What is gestational diabetes?
Gestational diabetes is an elevated blood sugar that occurs in pregnancy. It complicates about 3 to 4% of pregnancies in the United States. Because of the hormonal changes of pregnancy, your body needs to make more insulin when you're pregnant. And if your pancreas can't make an adequate amount of insulin, your blood sugar will go up.
Now the baby will make insulin response to the need, so the baby's now going to have a little bit of a hyperinsulin state?
Yes, the blood sugar in the mother crosses the placenta, so if the mother's blood sugar is high, the baby's blood sugar is high, and the baby's pancreas is real good still because it's young and healthy, so the baby secretes a lot of insulin, and that insulin causes the baby to get big and fat.
And there's a problem, some of these babies have more problems because of the gestational atmosphere, is that correct?
Right. These babies, they're bigger and fatter, so they're more likely to have difficult labors. They're more likely to be injured during the birth process. They're more likely to need a cesarean to be born. They're more likely to have respiratory problems after birth. And there's another host of metabolic problems that the babies have after they're born related to low blood sugar, because their pancreas continues to make a lot of insulin for a period of time, even though they're no longer hooked up to the mother who supplied them with the sugar while they were pregnant. And they have different problems with bilirubin, calcium, magnesium metabolism.
Would you let them go to term, or would you try to get them a little bit early?
Pregnant women who have diabetes, whose diabetes is well controlled and their babies are of normal size, we allow them to go to term.
If there's some complication, would you?
If their babies are excessively large, or if the blood sugar has not been well controlled. In pregnancy, we usually advocate early delivery after we do amniocentesis to check if the baby's lungs are mature.
Is that correct?
That's right. Try to keep the blood sugar as normal as possible throughout the pregnancy, and we monitor the blood sugar, frequently. Everybody gets a home glucose monitor. They measure their blood sugar, 4 or 5 times a day, and usually with diet and exercise, we can keep the blood sugar normal.